The doctors and teams that are easiest for me to train, that pick this stuff up the quickest, and they can implement it, and they're really good at it. They're like really good at the delivery, tends to be practices that are high-end aesthetics. If they specialize in high-end fee-for-service aesthetic cases, they typically do very, very well with this very quickly. And by well with this, I mean their delivery, it comes more natural because they're used to painting a vision, creating a vision, helping the patient create a vision. They're used to that sort of thing. Whereas a lot of general dentists and a lot of oral surgeons, periodontists, they're more used to solving problems, identifying problems and then solving the problem. Oh, we've got a problem here, or this tooth needs this, right? Or you've got, generalized 6mm pockets or whatever. You find problems and you fix them. So the problem with that is that most of these patients, if we just ask them what they want, these people don't know what they want. What's driving them is the pain, right? They don't want anything, as opposed to the cosmetic patient, right? Cosmetic patient that comes in for a big veneer case, a lot of times they'll show up and they'll have what in their hands? A lot of times they'll have photos. They've thought about it, right? They have an idea. They're there for a reason. Like, I want to look like this. How many times do you have full arch implant patients show up with pictures? No, that's not why they're there. They have terminal dentition. They stayed away from you until they have no other option. They stayed away from you until they lost all their teeth. So why are they there? Because they can't eat anymore. That's it. Like they have to be there. They don't want to be there. They don't want anything. So it puts us in a tough position. From a sales standpoint, somebody that is inquiring about a product or service that doesn't want it, they're forced into it, they're always looking for the cheapest and the fastest option. The option is going to cost them the least amount of time, energy, and money. Just get me out of pain, right? Whatever's going to get me out of pain, what's the cheapest, that's what I'm going to do. It's very different than somebody that wants a specific outcome. When they're making a purchase, they're trying to assess who can give me the outcome closest to what I'm looking for, and that's what's most important to them, but they're outcome-oriented. We have to make full arch implant cases or patients, we have to make those patients outcome-oriented. The problem is we don't treatment plan outcome-oriented. We don't. We just kind of treatment plan process, and then we sell what? Treatment plan and process, and we're selling procedures. We're selling treatments. That's what we sell.